hope you can hear me. This is Josh Sharfstein. I think I'm in the right place, which is breakout number 4, preparing for the second wave of COVID diagnosis. I hope we can use the chat function. If anybody else is here for that breakout group, that would give me confidence that I wound up in the right place.
I think you're in the right place.
Okay, excellent. Thank you. And do you want to introduce yourself, Mehdi?
I'm Mehdi Fanai from Hopkins, and I will be helping you with the tech support for the event.
Great, thank you very much. Okay, well, why don't we get started, because we have just 15 minutes. I think our goal here is to have a conversation about the diagnostic strategy for preparing for a second wave, and what kind of testing, particularly, or other diagnostic approaches are going to be needed to manage what potentially could be a surge in cases. So I want to open the floor to that, and maybe what we'll do is, if you want to speak, I don't know if it's possible to raise your hand on the controller. Do you know, Mehdi, whether they have that functionality to
The
raise their
attendees
hand?
are supposed to be able to unmute themselves and speak up. Can't they?
Okay.
If anyone
They
wants
probably
to
can. I'm just
raise
trying
their
to
hand,
think about whether it's, if you go to participants and you put raise hand, then that might make it less of a free-for-all. So if you go to participants at the bottom, you should be able to push in raise hand, and I could see it. But if that's not easy for the moment, we'll just open the floor to people. Anybody interested? Wendy, I give you extra points for putting on your video. Do you want to make a comment?
Hi, no comment at the moment.
Oh, okay.
But hello, looking forward to this.
Okay, great. Well, I mean, I'm happy to make a couple quick comments, but really the goal here is for conversation. So please raise your hand or jump in or type something in the chat. I'll monitor all that. I think that there are a lot of questions for diagnosis and the use of diagnostic tests for the fall. Among them are how to handle testing in a healthcare setting, like hospitals or clinics, and what should be done to protect healthcare workers. Another would be workplaces, and whether workplaces should incorporate testing as part of a strategy to permit economic activity while the the infections may be rising. A third would be universities, and what testing strategies should be there. And the challenge right now, as I understand it, with the PCR platforms is that there's some that can do many, many samples, and there's some that can go fast. But in general, and people can correct me, those are not fast and mobile, like right on the spot. There are not that many that can do fast and mobile for a lot of them right away. I don't know if that's possible. So you wind up having to decide between testing a lot of people but waiting to get the results, or just testing, using mobile rapid testing for a very select few people. And so people have raised the question, and maybe that is going to be very difficult for using testing as a centerpiece of a strategy. Testing could be, part of a strategy. If testing were to be more readily available, say with a antigen test perhaps backed up by a PCR, maybe that's a different strategy to consider as more testing becomes available in the second wave. So I'm just putting some of those thoughts out there in terms of the kinds of testing that might be useful in order to better understand what's happening with the second wave and then respond, maintaining our ability to function as a society while cases may be starting to go up. Definitely interested in other people's thoughts here, so please feel free to. Oh, we've got Wendy, you now are raising your hand.
Yes, hi, Josh.
And why don't you introduce yourself, please?
Yeah, sure. I'm a writer for a publication called MedTech Strategist and have written extensively over the years on diagnostics. I have a question on what is China, how is China, have you looked at China? Do you know what China's doing in terms of testing? Because my understanding is it's more surveillance and thermosensing than broad testing as workers go back to work. Do you have any sense of that?
We'll see whether somebody does. Let me just say, I should have introduced myself. So I'm Josh Sharfstein. I'm the Vice Dean for Public Health Practice and Community Engagement at the School of Public Health. So the question of what China's testing strategy is now, China's obviously in a very different point in their curve than we are in ours, but I could not speak knowledgeably about that question. Maybe somebody here could. Any questions there? I've done a couple interviews for our podcast, Public Health on Call, with physicians in China. And my sense is that they were doing viral testing to find the disease. You know, they're doing some surveillance antibody testing to understand overall exposure. But when there are potential cases, I had a strong sense they were using PCR testing.
No, but for regular work, for workers but for a healthy population, a supposedly healthy population, broad population-based testing.
I see. I don't know what different strategies they're using there. It's a good question. Okay, hearing no one else who could jump in on that one, we'll bookmark that. We'll see. The next question was from Jen Campisano. Jen, do you want to ask that question out loud if you're on?
I have a rambunctious toddler in the room. So.
Oh, that's okay. What is your background?
So I'm a patient advocate, and I'm on the board of the Society to Improve Diagnosis in Medicine with David Newman-Toker and a few others on this panel. But my background is as a lawyer and in the legislative realm. So I am interested in the policy side, but I'm curious as we move toward reopening. And there's been a lot of talk about antibody testing. And I guess just from a layperson's perspective, do we have a sense yet of whether the presence of antibodies equates to immunity, and whether that means that it is then presumably safe to go back into society?
Sure. So I'll put the link up here. The Center for Health Security at Johns Hopkins and Gigi Granval, who is an immunologist there, recently did a pretty comprehensive report outlining what's known right now. And I've also spoken with Arturo Casadevall, who's an immunologist at the School of Public Health and very involved in the serology studies. So I'll give my best answer to this question, which is right now, it is not known whether a particular antibody test predicts immunity and to what extent. It's also not known definitively how much having antibodies in general or having recovered predicts immunity. However, there is the expectation, I think, in the scientific community that those questions will be answered, and the answers will probably involve immunity for certain people and certain types of antibody tests. It's just, so in other words, it's not quite the case to say we think that there probably isn't immunity. I think in general, people really do think there will be because of the kind of virus this is and the responses to similar viruses and the fact that people are known to make neutralizing antibodies, which are apparently a kind of antibody that really does predict immunity, but that the current tests aren't necessarily correlated. And because the tests may be measuring different things, it may be that one test is a better predictor of immunity than others. And so the studies that are ongoing, this is a high priority to really understand. What all of these tests, if they are reasonably accurate, will do well is it predict exposure or explain exposure. But whether it predicts immunity will depend on additional research. Is it possible we'll find that there is an immunity from antibodies? It's theoretically possible, but I think it is not expected by people who are watching very closely. And I think they're quite hopeful that as this testing sorts out, we'll be able to provide some guidance. Now, whether that is enough to be able to be sure based on the result of a test that somebody is truly immune, all that is going to have to be worked out. But I'm open to any further questions from you, Jen, or from anyone else, other opinions or perspectives on that? And I'm looking for the paper. I think I've got it here. I'll put the link here. This is the link to the report that I just mentioned. Okay, we have another question from Leica. Leica, do you want to ask your question out loud?
Hi, everybody. It's very nice meeting. Thank you for organizing this. Very simple question. The virus has its own mutation rate, and so far we assume that molecular diagnostics and immunodiagnostic methods work. But as the virus evolves, do we?
Sure. And could you explain your background? Leica, we might have lost you there. Well, why don't we plunge forward with the question, which is, will the virus mutation rates affect the molecular assay sensitivity? I'm guessing there may be someone who can answer this a little better than me, but I'll tell you my understanding, which is that while this virus is mutating, it is not mutating as much as many other viruses do, or at least some other viruses do. And that the purpose of the test was to try to find very conserved areas. So the primers would be unlikely to change if there was a mutation. And so in general, I think this is not thought to be a major concern, but obviously, as you point out, it's theoretically possible. I think that they look to do the PCR primers based on parts of the virus that they do not think will be subject to a lot of mutation. But again, I'm open for someone who's a molecular biologist to jump in and correct me, but that is my understanding, talking to a few people. Okay. Other questions, comments from anyone? Here's a good one. Zhu Young, do you want to ask your question? Do you want to open up?
Oh, yeah, thank you so much for your hosting this session. So my question is, we don't see a very big second wave actually in China after its reopening. Although the schools are still not open yet, but all the factories, companies, they already all open, and we don't see a big wave. So my question is in Maryland, when do you think we will reopen, and what strategies are we going to take in order to flatten the curve after reopening?
Thank you. And tell us your background.
Oh, I'm a postdoc in anesthesiology department in Johns Hopkins Hospital.
Great, great. Well, thank you. So two questions. When do you think we will reopen in Maryland? So the governor has set out certain criteria for reopening, which include clear evidence of downward trend, which we don't quite have yet in Maryland. I think we certainly can hope and expect that some of these criteria will be met over the next several weeks. And so hopefully this spring we'll start to see a gradual reopening. But of course, the pace of reopening will be dependent on how many cases come back after that happens. China, you're correct, has not had a big second wave, but I think the concern for the second wave is really with respiratory season in the fall. So China was out in front of us, but not by that much. So in theory, they could still be subject to this. China has also been, incredibly aggressive on the public health side and has been able to drive the levels of the virus very, very low. I think what we're seeing in the United States is that we're starting to reopen well ahead of when China considered it. I was speaking to people in Shanghai, and they were saying that they would start to reopen after they had 14 days of no cases that were community transmission that weren't linked to an
strategy.
Yeah. So their strategy was to really drive the cases way down. What we've seen in the United States is that people do not have that level of patience or confidence, and they're pushing to reopen well ahead of that. And so I think when you have a lot more circulating virus and you're reopening, you're at much higher risk of a surge in cases. Now, what strategies are we going to take to flatten the curve after reopening? is a good question. I think the goal is to have a strong public health response, which of course we didn't have the first time because we couldn't test and we weren't really ready therefore to be able to track, isolate people, track their contacts, and quarantine the contacts. So the goal is to have a strong public health response. That would be one major strategy that we didn't have before to control the spread of the virus, so that we wouldn't just have to shut down so much of our society in order to slow the spread. So that's what the state is really racing to get set up as quick as possible.
Thank you.
Great. Any other questions? I know it's about the 12:30 time, which is a time for the shift. So if people want to jump into one of the other breakouts, feel free. But otherwise, we'll keep going. Thank you, Heidi Mannion, for turning on your camera. How are you doing?
Okay.
Good. Any questions that you might have?
I was actually joining for the next session.
Oh, okay. All right. That's good. I think we can, we're seeing a little bit of a shift, so why don't we wait just for a second? All right, I think we're starting to see people jump in. So I'm Josh Sharfstein, the Vice Dean for Public Health Practice and Community Engagement at the School of Public Health, and this session is called Preparing for the Second Wave, and we're trying to make it interactive, get people's thoughts about what it will take to prepare from a diagnostic perspective for the second wave. And so if you have questions, there are a few things you can do. You can raise your hand by hitting the participant button at the bottom and hit raise your hand if you want to speak, or you could just turn on your camera. That will be a good way to signal that you might be interested, but you could turn on your camera and not speak too. That's totally permitted. So hello, Amy. Heidi Mannion, do you want to introduce yourself and ask a question?
I'm just saying hi. I'm Heidi Mannion. I'm
Okay.
a patient family advisor at Hopkins.
Okay, great. Nice to meet you. Okay, so let me keep a couple thoughts here. I think, the original strategy for testing on the first wave was a mad dash for as many tests as possible because we were so behind in testing. Now, if we imagine that we're at risk for a second wave at any point, but particularly this fall as the respiratory season scales up, people are already starting to think about, well, what is our diagnostic strategy for testing, for keeping the economy open? So the idea is we start to open the economy, we have some social distancing, and then we want to keep it open. We want to manage the number of cases. So what does testing look like then? And there we're talking about not just the need to identify cases, but particular functions that people will be thinking about, like elective surgery, what testing is necessary for that, or universities, how is the university gonna, or is it going to maintain people in dorms, and what testing is appropriate for that? And there's some technology issues because in general, for my understanding is that for the PCR testing, you can do a whole lot of them, but you need a big machine. So that's going to take time, or you can do one at a time very quickly, but that doesn't give you scale. So to be able to do things very quickly, but at scale, it may require antigen testing, the science of which is not totally worked out, so that we can have highly accurate antigen testing, maybe backed up by PCR. So there's, and then there's the role perhaps of antibody testing just to assess the population exposure. And eventually we hope, if the evidence comes through, be able to predict immunity. So there's a lot to be worked out for the second wave. So we're open to questions or comments from anybody here as they think about the second wave of infections. Could be the second, the third, the fourth, and the fifth wave. So we had a very good discussion in our first little section here. So please, please jump in. I can tell there's some great people who are in this group already. I'm sure everyone's great. So please jump in. And Heidi, you might want to mute yourself there if you're not.
Could I ask a question?
Sure, please introduce yourself.
Yeah, I am a patient safety advocate in Washington, Seattle, Washington.
Okay.
And I really appreciate your session topic. And you mentioned that, the United States, we opened early than China, and testing is not up to the speed. And the public health needed to really ramp it up because it has been lacking since the beginning. So I wonder if you would share your thoughts on, there are two things. What's your opinion on how we can ramp up a public health system to prepare the nation for the second wave? And also, what's your thoughts on the concerns about the accuracy for the antibiotic test right now?
Sure. So the public health response that we need, and if you wouldn't, yeah, thank you. The public health response that we need is to be able to identify where the virus is and stop the virus from moving from person to person. That's the essence of the public health response. And so what we want to do is have testing as quickly as possible for people, help them isolate themselves. So that means not just telling them to isolate themselves, but helping them if they can. And that may well mean giving them a hotel room or someplace they can go for the duration of their illness, assuming they don't get too sick and need to go to the hospital, away from other people. So we need, or it could mean if giving people food delivery or other things to help keep them at home. So there's a whole part of that public health response for that person. And then you want to be able to find their contacts, the people they may have already transmitted it to. And generally people are thinking a couple days before the onset of symptoms. So if you are diagnosed a day after you start having symptoms, then you would explain who your close contacts were for the last 3 or 4 days. And then public health will reach out to those people, say, we think you've been exposed. They won't say who you are, but they'll explain that people need to quarantine themselves for 2 weeks in order to be safe from passing this on to other people. And again, some of those people may need to go to hotels if they cannot do this safely at home. And they may also need different types of support to be able to do it at home, like food delivery. So you need a big strategy to be able to find, which could be 10 or 15 or more contacts per person, give them instructions, give them resources, and particularly think about the home environment and reducing the chance for people to pass it on within the home environment. So that's really the basis of the public health response. And that's what a lot of states are now really scrambling to do as quickly as possible. And I'm trying to remember if there was another part of your question.
Yeah, my other question is, what's your thoughts on the accuracy?
Oh, of antibody tests, yes. So in the chat, you can see I put a publication in called Developing a National Strategy for Serology, and it talks about this at length. So the Food and Drug Administration allowed the marketing of antibody tests before any data was reviewed, and the quality appears to be quite variable. So there are two issues with antibody tests. One is, do they actually measure effectively what they're trying to measure? And then second of all, what does it mean, what they're measuring? And for the first one, we're hopeful that this will be sorted out as tests get validated. We'll know their sensitivity and specificity. We'll know that they are measuring antibodies. The second issue, though, is what does that mean? At a minimum, it'll mean that people were exposed, I think, to the virus. But will it mean that they have some immunity? That we won't know until there are further studies that correlate a specific kind and level of antibody with a certain, strength of immunity. I think it's generally expected that we will find that there are connections between antibodies and immunity, but exactly what those are, what kind of antibodies, how much immunity, all is going to have to be worked out. That's what that report gets into in detail. And I'll also put in here, if you're interested, that we have a podcast called Public Health on Call, and we interviewed the lead writer of the report on that podcast, and she had a lot of interesting things to say. Other questions or comments from anyone?
May I follow up on the another question that follow up on your comments about contact tracing?
Sure, please.
They have been talking about how we do it. It requires our army of people really in each state to keep tracking, who got and who should be isolated and be contact. What do you think is the best strategy for doing that? They have been talking about using iPhone phone apps and to ask people to download the software. But there are a group of people really concerned about the privacy or those issues. So do you see anything we can found a way to address people concerns and also be able to get people to participate this type of massive tracing problem?
Sorry, we can't hear you, Dr. Sharfstein.
I think I just realized that. I gave such a good answer, though. Oh, well. All right. Thanks for jumping in there. And now I see it here. Same here, same here. I don't hear anything. Okay, sorry about that. So let me just be a little bit more succinct then in my answer. There are two ways to think about it. The technology can support a standard contact tracing effort from a public health department. And the example I was giving was, let's say I'm reaching out to you and you're a case, and I say, like, will you tell me who your contacts are? And you go, sure. Can I just, I go, can I text you a link and you can put them into the website? And you go, that's totally fine with me. Or you might say, actually, I'd rather tell you them by hand. And I go, that's fine. So you could imagine just technology helping. But there's a separate concept that's being discussed, which is technology being its own thing, that the two phones are communicating with each other. And the first thing to know about that is it really hasn't been proven that that works to really identify high-risk contacts. The second thing is both people need to have the app on their phone. So unless there's a lot of uptake, you wouldn't necessarily really have that much of an impact. And the third thing is those apps have not been, those things have not been really integrated with the public health response yet. So it might just be that it's a message to someone, but that message doesn't come with an offer for food or housing or other things that might actually make it possible for them to quarantine themselves. So my biggest concern right now is that it's a completely separate discussion from the public health one that needs to happen. Apologize for the problem there. I think we might be getting to the swap time for everyone in case people want to swap, but here's one more good question from Swati. Swati, do you want to ask that question? Are you still here? I can read it. After each country flattens the curve with their robust measures, how are we going to contain the infection and prevent it from reappearing once countries open their borders? Well, I would just say that that first part of this, the story is going to be challenging for a country like the United States with so much infection. If we were able to really drive the numbers down very low, then that increases the utility of different kinds of strategies for the border. Like you saw, New Zealand has a very aggressive strategy for the border, but that's because they've driven their internal infections down very low. Same with Australia. But if you have a ton of internal infections, then the border is not going to matter that much. So I think it's going to be interesting to see how far countries can get before they start reopening, and whether or not they're able to get so low that for them, it really does, the border issues start to matter a lot more. I think we don't know yet. You are from Auckland, New Zealand. That was a good question then for that. What's it like in Auckland? How does everybody feel right now? Scared, really. Interesting. I think a lot of us feel jealous of where New Zealand is at the moment. Next question is from Amy Eichner. Amy, I thought I saw you for a second there. Do you want to ask it orally?
Sure, and it took me a while to figure out how to change the privacy settings on my phone. So if other people are having problems, I've got the answer. Yeah, so do you anticipate that states will have a unified approach to reopening, or do you think they'll be wildly variable? And I guess I'm asking in the context of nationwide businesses such as sporting events, which take place in many different states with traveling teams, et cetera.
Sure. And maybe, Amy, I know who you are, but do you want to explain to everyone your background?
Sure, yes. I am from the U.S. Anti-Doping Agency. We're the drug testing agency for Olympic and Paralympic sport in the U.S.
Great. I'm happy to open the floor. I can tell you we do not have a unified approach to reopening, as you can tell from the differences between the states already. I think we're seeing some of the southern states particularly plow forward with pretty broad reopening relatively quickly, but not total reopening. So we're going to see. One thing I would say is pretty important is that you have what the government strategies are, and then you have what the people are doing. And so you could have two different states. One of them opens restaurants sooner, but nobody goes out to the restaurants because they're afraid of getting sick. So, it's really going to partly depend on what people are doing in addition to what the policies are. I think that we're going to see some variability in sports, but I think that the major, like Olympics, hockey, baseball, basketball, football, they'll make nationwide decisions. I don't think they'll say, the decision will be for everybody. Now that decision might involve permitting certain things in different areas of the country where the spread is extremely low, potentially. So it's going to be interesting to see how they weigh the risks. I think one of the biggest issues that for governors or everyone else is, how to judge the risk and how to tolerate a certain amount of risk responsibly. And so I think we're going to see people drawing, not just making different decisions, but drawing that line on risk a little bit differently too. Other questions or comments? I see the nations combating the virus to get the vaccine out. But in your opinion, is a vaccine or effective drug treatment would be a breakthrough? I'm not sure exactly Swati, what you mean there. I think a vaccine would really be great if we could get a vaccine and get it to people, because that would, basically build up enough immunity in the population that the virus would stop, essentially being even a minor cause, I think, of serious illness. But a treatment could be helpful, particularly at saving lives. So it might not reduce the demands on the healthcare system very much, but it might, depending on when it could be given. So I think, there's going to be some interesting news today, I understand, because Gilead has announced positive results from a trial of remdesivir. And so that will be looked at to see, how significant the results were, at what stage of the illness. And I know there are a number of different remdesivir trials to see whether it might help more early. It's possible that a drug could help quite a lot early, that doesn't help that much at all later in the illness, or vice versa. So when we're seeing these studies on treatments, we really have to look at the particular patient population that's being studied. I mean, part of the reason we're doing all this testing and tracing and all that is to buy ourselves as much time as possible, preserving what we can of our economy, so that we can give opportunities for the scientists to help find us treatments and vaccines. Because I think ultimately both of those will be extremely important. Other questions, comments? We're kind of in our last section here. I'll just say very briefly that I'm Josh Sharfstein, the Vice Dean of Public Health Practice and Community Engagement at the School of Public Health. And we've been talking at this breakout about a potential second wave and whether diagnostic strategy needs to be different. Thinking about different areas like hospitals or universities or just generally society. So if people have questions, feel free to raise your hand using the raise your hand button or just unmute.
This is Yanning Yu. Do you have time? Have one question?
Yeah, let's do one more. Go ahead.
Okay. So, what is your thoughts on the number of the best number or optimal number of tests that we should do population-wise in order to move forward?
That is a great question, but I'm not going to answer that, because that is the very first question that I'm going to ask in the next plenary session to Dr. Jha, who's been writing and talking about this all over the place. So that the next session at 1 is going to be about the public health perspective on testing. And the first question is going to be, all right, how many tests do we need? So I think maybe what we should do is end this, because I've got to get prepared for that, which is going to start in just a couple of minutes. And is that okay, Yanling, to take get the answer there from a bunch of people who've really thought about that question?
Sure. I thank you very much.
Okay. Thanks, everybody. And I'll see you back in the other
Thank you so much.
the other session. Thanks, Mehdi, for everything.
Sure. Bye.